Welcome to Toledo Clinic TV. Our guest for this segment is Mike Duramo. He's the Chief Administrator of the Toledo Clinic, and you have a lot of initiatives underway that really work to improve access for patients so that they know where to go and how to go get care.
Yes, we're proud of a number of them. Some of them are, or I guess you would call them basic, simple things. Probably one of my personal frustrations over the last 20, 30 years of being in administration is, unlike other businesses, medical offices have a tendency to do things that other businesses don't do. You know, turn phones off at lunch, shut the phone off at 5:01, and the dilemma, you know, was we started getting more and more employers that we engage and saying, "Gosh, my employees are trying to get in to see you, Mike, but you know, they called at lunchtime and the office was closed." So turn the phones on, you know, make it accessible for patients. So those are the simple things the clinic's doing to augment that process and get patients in the door. Some of the more, I'd call sophisticated things are what I would call our urgent care or after hours care strategy. We do have two urgent cares. Dr. Ash Felix manages a urgent care in Springfield Township and another one in Bryan, Ohio, which is, you know, quite a ways away, but nonetheless, the Toledo Clinic banner is out there. But also we have a relationship with a little clinic that are part of the Kroger system that gives our patients after hours weekend access to, you know, often patients will perceive as emergent care. So they're like, should I go to the emergency room? But the little clinic can take care of a considerable amount of those kind of problems. So between Dr. Felix's initiatives and the little clinic, we think we've done a pretty good job of expanding our access points.
Are you hearing that from patients, that
we
they're
are
able to?
You know, I'm kind of that guy who says, you know, can you show me the data? You know, but anecdotally, it's been coming back and it's been looking pretty good. You know, I've had a number of doctors call and say, hey, gosh, it's great that we're finally doing this. Our accountable care organization has indicated our patients going into emergency rooms are less often for, you know, sometimes simple things like fevers or, you know, bruised knees. So you want those patients to be taken care of in a far less expensive environment, and they you know, they're not waiting for 2 hours while more serious things are getting in the way.
So you're not just making it more convenient for patients, but you're also really cutting down on costs overall.
Absolutely.
And how are you ensuring that the quality is still there?
Well, and that's, you know, there's twofold. So if you look at our urgent care strategy, that's part of the clinic. I mean, I have to confess that being an independent urgent care in today's environment's got to be pretty difficult for those businesses that do that, because you need that affiliation, that continuum of care, hopefully some type of good hospital relationship. So having our own urgent care has been a good strategy for us. And employers like it because, hey, my new employee needs a quick drug test, for instance. And then the little clinic, again, our physicians and the little clinic do meet. We have met with their executive director, Connie Palacadetti. We've met with their chief medical officer. And the objective is to meet early and often to make sure we're on the same page.
All right.
So far, so good.
Sounds fantastic. Thank you so much, Mike. Appreciate it.
Thanks for having me.
All right. We'll be right back.